Welcome, everybody. This is the Cam Steps podcast. My name is Sam Illaiee, and we are here to talk about all things leadership, healthcare, and how you make services better. Over the course of this podcast and the many episodes that will come later, we will find out all the things that I know, probably all the things that other people have taught me, and for those brave enough to come and join me on the podcast, others as well, and their views and their thoughts on how things should be and how we can get there, developing this podcast as we go along. We will learn a lot together and we will share a lot together. And just so you know, that people inspired me to make this podcast because of the number of questions, the number of people who, through coaching and through other mentorship programs, that have asked me just to put something together so it's in one place. So that's what we're doing here. Okay, so everything that I've learned from my time in the health services and all my different roles and all the different connections I've had, I've learned a lot. And normally I take many notes mentally and then physically write notes. This is what you're going to get on this podcast. The target audience for this podcast is really anyone who's working in healthcare, anyone who's working with children and young people, anyone who could be working with people with levels of distress and their families and their carers and their systems around them. These are the people I want to target. So if you're a healthcare provider, manager, or leader, definitely for you. If you're someone who works in healthcare and wants to influence your manager, it's definitely for you. If you are people who use services, healthcare services, this podcast is for you because you'll learn how to influence services and how to help them change through processes like co-production. So when you are on the podcast with me and you're listening, and hopefully we're going to keep these podcasts to between 10 and 20 minutes. So when you're on your way to and from work, you've got a 10-minute listen or a 20-minute listen, not longer than that. Perhaps when we have guests on, it may extend, but generally the lessons that we'll teach, will all be about 20 minutes long at the maximum. So we won't bore you. Okay. And if you're watching on YouTube or any other social media platform which has got video, then use the comment section. And if you're driving or watching or listening to this on the podcast through Apple Podcasts or Spotify, then I'd advise you to, when you get a moment, then you can drop us an email or send us a message on our handle or in the comment section if those platforms have that, and we will get back and we will look to make more content based on what you want to hear. That's what co-production is about. So my professional background, so if we do a little bit of background so you get an idea where this podcast can go. My professional background, I trained to be a pharmacist all the way back in the early 90s and qualified in 95, 96. Worked in that arena for a good 15 years and still dabble in there. Currently provide training to pharmacists and other healthcare professionals at the moment, and help services transform. But after my time in pharmacy, I'm a little bit maverick for a pharmacist, and then I moved into the NHS in the United Kingdom, which is a national health service, and started off as the lowest banding a pharmacist could join, and slowly, because of these skills, I would say human skills and professional skills, managed to move through the organizations that I worked through in terms of promotion and getting more opportunities and stuff like that. It's all about what you give into the organization. Then I moved into a role as a clinical pharmacist, and I found myself gravitating healthcare for children and young people, mental health care for children and young people. And through that, I just became attracted to the service area, curious, and I understood that at this point is an opportunity to really help people, because I'd seen people at the high end and the chronic end of mental health difficulties and wanted to really make a big difference. Now, everyone wonders, it's very, very strange for a pharmacist to end up in logistics and management in child mental health or in healthcare services, and to become a manager, to become a leader in that area. So yes, as a pharmacist, we're trained to be very meticulous, pay attention to detail, understand things very well, really systematically think about things. And those skills are very, very transferable. If you understand how to transfer the skills that you have into another service area, that's the way you move mountains. Okay, the other side of it, I'm a little bit curious by nature, and I'll always push boundaries, and I'll always look for another way of doing things. One person always, remember, she said to me, Sam, you're always the person that makes me understand that it's not always one way to do something. And that's what I'm like. So that's what you'll expect to hear on the podcast. And in the NHS, in terms of what we've achieved in working in the NHS, we've transformed a huge service, which is our biggest achievement, with the help of the management and leadership and stakeholders there. But understanding where the risks are, understanding what is your true purpose, and doing that, and then building technology is another part of my passion that developed over time. We built technology, and I've continued to do that. So you'll hear a bit of that if you want to hear that. And then the motivations to do that role is really about leadership in the NHS. So wherever it is, I wanted my leadership skills, and we've been training people and coaching and mentoring people for a long, long time now. And that's what we want to do. That's what we want to continue to do in terms of where we want to get to in the NHS. We want great leaders who have good understanding of services, good understanding of humans, and good understanding compassionately on how to get the best out of people. So the primary goals for this podcast, number one, is to reach people so I can share what I have, pitfalls, trappings, good practice, because one of the main things is about sharing learning. If you want more in-depth diving and stuff like that, you need to please get in contact with me, and then we can arrange something. But this is like basic stuff that everyone needs to know what I've learned, so people don't fall over at the same first hurdles. Okay, and we hear it, and like a lot of the coaches that I work with, sometimes they've fallen into the same traps that others have fallen into, and no one's told them better. So this podcast is going to really, really go for that and try to iron those out, and it will impact you. We expect the podcast to impact you and get you to think differently, work differently, learn differently, and help others very, very differently. Okay, we want you to be the best version of yourself. And my motto, as you'll see on my signature of my emails, is to leave you better than I found you. Some of the challenges that you'll find is that we will talk about difficult stuff. So we will talk about why services don't work, what taboo stuff that people don't really talk about on the front line in services, but we'll talk about here without mentioning any names and breaking any kind of confidentiality rules. But we will look at scenarios, we will look at case studies, fictional to a degree, but in reality, most of you will resonate with these fictional case studies. We will look at why people allow services to fail, why the NHS is not as efficient as it could be, and then the future topics and stuff like that. We've got about 20 podcasts planned after this one, but we're looking for people who want to come and talk to us on the podcast. We're looking for ideas, questions that you have, so we can expand on those and build a podcast for you. So if you want to stay connected to this podcast, like subscribe. If you're on YouTube, again, subscribe to this channel, and if there's a bell icon, turn that on. If you want to listen on Spotify or Apple, just make sure that you tag this podcast, and it will come as soon as we get a new podcast up. It will come on your live feed. We will try to upload regularly every Monday. So you have the podcast. It will go out once a week. So you will have the latest information at hand every week. We may put tasters out over the weekend, but the podcast will go out every Monday, hopefully, God willing, every Monday going forward. And that is this introduction session to the Cam Steps podcast. Thank you for listening, and I hope to see you soon on the first true episode next.